Contraception may seem like a relatively new phenomenon in the grand scheme of history. However, this assumption is false. Historians have records of linen condom-like devices being used in Egypt as early as 1000 BC, either for disease protection or ritual. Similar devices were popularized in feudal Europe during the end of the 15th century, when it became known that they could prevent the spread of various diseases. The contraceptive industry, however, did not flourish or cause outrage until much later. In 1844, Charles Goodyear patented vulcanization of rubber, which led to the mass production of rubber condoms. This sparked the market for contraceptives and led to the development of IUDs, diaphragms, and other devices. During the reform period of the late 1800s, when people were concerned about the declining moral standard of American society, a man named Anthony Comstock made it his mission to pass a series of laws that would make all forms of contraception illegal. An anti-obscenity crusader, Comstock argued that contraception encouraged extramarital sex, infidelity, and was a sin because it prevented the formation of life. This was one of the first instances in which birth control was portrayed as a hazard to society and widely publicized enemy of the church. Comstock's laws were passed in 1873, although the industry found ways to get around the laws by advertising contraception devices as feminine hygiene products. In 1898, the mother of teenaged Margaret Sanger passed away from cervical cancer after giving birth to 11 children. Sanger became a nurse in order to aid survivors of botched abortions, from which thousands of women secretly suffered or died from. Her ultimate goal was to invent some magic pill that would prevent women from getting pregnant, but she did not have the monetary resources to fund research. In her radical journal, The Woman Rebel, Sanger instructed women on times when it would be wise to avoid pregnancy, such as when ill or in poverty. The New York City Postmaster banned this issue of the journal under the Comstock Law category of obscene, lewd manner. In the June 1914 issue of the journal, Sanger coined the term birth control. She was thereafter charged with 9 violations of the Comstock laws and left the country for London to continue her work. The ideologies of the U.S. changed while Sanger was overseas. During World War I, condoms became legal in the U.S. when troops ignored Army advice to abstain from sex while overseas. They obtained condoms from other countries and brought them home. The significance of this is exemplified with the fact that birth rates in the U.S. dropped by 50% 2 years later, in 1920. Eventually, the medical importance of birth control was acknowledged, and it became legal to use contraceptives to prevent life-threatening pregnancies. This led to Margaret Sanger opening the first legal birth control clinic in 1923, which set the platform for the development of Planned Parenthood. It wasn't until 40 years later that the FDA approved the first birth control pill, Envoid, and the Supreme Court officially abolished the Comstock laws. Abortion, however, remained criminalized in the United States until the famous Roe v. Wade court case of 1973. Roe's central argument was that a woman has the right to abortion until viability, meaning until a fetus has the ability to live outside of the mother's womb, albeit with artificial aid. This was defined at approximately 7 months. Roe v. Wade prompted a national debate that has not yet been resolved, including issues about whether abortion should be legal, under what circumstances, and what the role of religious beliefs should be in the political sphere of lawmaking. As of today, the Catholic Church alone holds the historic Christian position on contraception. According to the Catholic Church, contraception is wrong because it is a deliberate violation of natural law. The Catholic Church states that the natural purpose of sex is procreation, and that the pleasure it provides is simply an additional blessing from God, intended to offer the possibility of new life while strengthening the bond of intimacy, love, and respect between husband and wife. Sexual pleasure within marriage becomes unnatural and even harmful to the spouses when it is used in a way that deliberately excludes its basic purpose, procreation. Because of its strongly held beliefs, however, the Catholic Church has run into conflict into our ever-changing modern times. Many people claim that their stance on birth control is unreasonably strict. Most Catholics do not even follow these rules. In fact, according to a recent Gallup poll, 82% of Catholics find the use of contraception morally acceptable. The most recent controversy surrounding the Catholic Church and its stance on contraception has been its issues with the Affordable Care Act, part of which would require religious colleges and hospitals to offer preventative health care, including contraceptive coverage with no deductibles or copays.
New or renewing health insurance plans must now cover 8 preventive services to women at no out-of-pocket cost, including annual OB/GYN exams, birth control, breastfeeding counseling, and screenings for sexually transmitted diseases and HIV.
The money that gets saved by not paying for women who get pregnant is vastly it is vastly less expensive to pay for birth control than it is to pay for a woman's pregnancy. So generally, that's considered a cost saver.
The Church claims that this law would be unconstitutional, violating religious freedom because it requires religious institutions to provide something that is against their beliefs. Many members of the Catholic Church, such as 2012 Republican presidential candidate nominee Rick Santorum and Cardinal Dolan, have spoken out against its use.
President Obama decided that he could impose his values on people of faith when the people of faith believe that this is a grievous moral wrong.
Cardinal Dolan spoke out against President Obama's plan, saying it violates religious freedom by forcing the church to participate in something that is against their fundamental beliefs.
Any type of interior tampering by the state into defining a church's ministry, who it could serve, how it can serve those people, what it needs to do, is simply unconstitutional.
Against religious freedom, and the example that Cardinal Dolan gave was that they're not going to make the Amish, walk around with a gun because they don't believe in violence, and we don't believe in contraceptives and giving them out. So why should the Catholic institution have to provide those things to women?
Institutions whose business is only religious, like a church or a local parish, would be exempt from President Obama's contraceptive plan. Cardinal Dolan says he is considering taking legal action if the plan is approved.
The other side argues that a for-profit company should not be able to deny contraception coverage based on religious reasons, and that women may need birth control for health reasons, not simply just to prevent pregnancy. The Patient Protection and Affordable Care Act, colloquially known as Obamacare, is widely regarded as President Obama's signature piece of legislation. The President and Democratic Party firmly assert that the Patient Protection and Affordable Care Act will ensure that all Americans have access to quality, affordable health care, and will create the transformation within the healthcare system necessary to contain costs. Although the summary presented by the Democratic Party may appear non-contentious, many provisions within the several thousand pages of the bill are highly controversial. One such provision is the contraceptive mandate, which requires new private health insurance plans to cover all FDA-approved methods of contraception without out-of-pocket costs to the patient. This mandate is based upon the recommendations for women's preventative health care issued by the Institute of Medicine. Although at first glance this provision may appear innocuous, it has stirred a vehement response from individuals and organizations on equal side of the issue. One of the most prominent supporters of the contraceptive mandate is Sandra Fluke, a law student at Georgetown University who was propelled into political prominence after she testified before Congress and defended the bill.
A friend of mine, for example, has polycystic ovarian syndrome, and she has to take prescription birth control to stop cysts from growing on her ovaries. After months of paying over $100 out of pocket, she just couldn't afford her medication anymore, and she had to stop taking it. Without her taking the birth control, a massive cyst the size of a tennis ball had grown on her ovary. She had to have surgery to remove her entire ovary as a result. As she put it, I will have no choice at giving my mother her desperately desired grandbabies, simply because the insurance policy that I paid for, totally unsubsidized by my school, wouldn't cover my prescription for birth control when I needed it.
Ms. Fluke utilized pathos to evoke a sense of sympathy from the members of Congress, attempting to sway them to support contraceptive coverage. Despite her powerful rhetoric, many individuals on the opposite end of the ideological spectrum remained unconvinced. One of the better composed responses came from the popular conservative television host Bill O'Reilly.
So let me get this straight, Ms. Fluke, and I'm asking this with all due respect, I am. You want me to give you my hard-earned money so you can have sex. Obamacare mandates that I have to buy health insurance. I have to. And because female contraception is included in all the plans, my premiums go up a small amount. So why then won't the government pay for my activities? For example, I played college football. The government should have bought my equipment, my helmet, shoulder pads, cleats, because if I don't have those things on the field, I might get hurt. And that might cost society a lot especially if I don't have the money to pay for my hospital stay. So surely the taxpayer should have ponied up for my football activities.
Is O'Reilly correct in his assertion that Ms. Fluck's primary goal is to obtain coverage for her recreational activities? Will the cost for everyone else really rise if this policy is enacted? Is O'Reilly's comparison to coverage for college football appropriate? Jon Stewart, the host of the satiric hit The Daily Show, vehemently disagrees.
This isn't about paying for women to have or not have sex. It's about an insurance mandate from the government covering contraceptive medication as part of women's overall health care. And two, it's not your tax money that pays for it. But I'm not even going to get into your roundabout argument about how somehow money is taken out of your pocket to pay for Georgetown's private insurance plan, whose contraception coverage would ultimately bring insurance rates down. I'm not even going to get into that. And I'm not going to get into the Catholic Church because you don't even pay taxes at all. So I'm just saying.
Clearly, both sides of this issue hold strong beliefs. But does either side have anything other than sentiment to back up their conviction? 1.5 million women use contraceptives for non-pregnancy-related reasons. Hormonal contraceptives benefit millions of women beyond the realm of pregnancy prevention. Many women use them to lessen the severity of premenstrual syndrome symptoms, which include cramps, fatigue, bloating, headaches, and hormonal acne. Sometimes, the abdominal pains can be crippling, and headaches can reach migraine-like intensity. Even more severe health problems, which are often life-threatening or fertility damaging, can be controlled using hormonal birth control methods. These serious conditions include endometriosis, ovarian cysts, and amenorrhea, which is the lack of having one's period as a result of low weight, excessive physical activity, or damage from radiation and chemotherapy. In addition to the usefulness of birth control to women's physical health, it is important to acknowledge the benefits it provides in the realm of preventing unwanted pregnancies. It allows women to make alterations to their lifestyles before getting pregnant, such as losing weight, lowering blood sugar, ridding oneself of an alcohol or drug habit, or quitting smoking, all of which would be detrimental to the health of the baby and would potentially have additional costs. Furthermore, if a woman and her partner wish to achieve a better sense of economic stability before having a child, it is extremely important that they have the opportunity to do so for the health benefits of both the couple and society as a whole. Societal benefits are what many people are justifiably concerned with. It is important to note that there will be less social welfare dedicated to supporting families or individuals that were economically unstable and had an unplanned pregnancy due to lack of access to birth control, and the use of birth control to hinder severe health problems will prevent women from needing expensive surgeries and extensive care. The cost of one Medicaid-covered birth in the United States today, including costs for prenatal care, delivery, postpartum care, and infant care up to 1 year after birth, totals $12,613 on average. The average per-client cost for contraceptive care that could have prevented that pregnancy would have cost $257 in comparison. With more affordable access to birth control, it seems like these savings will likely grow. Micromanaging each individual woman's reasons for using birth control is neither easy nor practical. In fact, some believe it to be morally wrong, and such procedures leave many women without the care that they need. The administration believes the Affordable Care Act to be a solution to such a prominent flaw in our system. One question is the most important of all. What do you think?